Welcome everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast. I'm your host, Yaron Ivan, as usual, and today, again, some more important rules that hopefully will help you take care of your patients. Rule number 159. Be aware of the intermittent conditions. So this is a rule that is just important to keep in mind the fact that when you're seeing the patients, you're seeing the patients in a moment in time. And a lot of times, many times, what you're seeing in front of you is not actually the real picture. A good example is those kids with intussusception. Oftentimes, when I see kids with intussusception, the parents say the child has been very fussy, intermittently fussy, he's fine and then he's not, he's fine and he's not. And that is a very, very concerning history for intussusception. However, majority of the time when I see those kids, I don't see anything on my exam. The exam is normal. While I'm interviewing the parents, the child seems okay and he's not crying, and all the details I have, I get from the history. This is because oftentimes the symptoms of intussusception are intermittent, and if during your exam the child looks okay, you may be persuaded to believe that the child is fine, has no surgical abdomen, etc. But one must realize that intussusception is an intermittent condition. Oftentimes, when you're examining the child or talking to the parents, there's really nothing to find on physical exam because it's an intermittent condition. Another good example that I think all of us know very well is those kids with bronchiolitis. I've had many situations when the resident or the medical student present a child with bronchiolitis and make him or her sound mildly ill or not ill at all. However, when I go into the room, the picture is very different. That's because bronchiolitis changes very quickly. Once enough mucus accumulates in the airway, the kid is tachypnic again. Again, it's an intermittent condition that can change very fast. And one must realize that and understand that what you're seeing in front of you right now may not be the real picture. Now, this rule was inspired by a recent patient I saw in the pediatric ER. So at some point on my overnight, I was working with a senior ED resident who presented a patient that came in with vomiting. My senior resident did an excellent job taking history, and he actually listened to my podcast in the past and said, Yaron, this kid violated the white rule. Mom said that the vomit was green. However, his physical exam that he described was fantastic. The resident mentioned that the child looked well, had no abdominal tenderness, was not fussy, not crying. When I looked over the vital signs through the EMR, they were completely normal, which really does not go along with bilious emesis of a newborn that usually suggests malrotation with volvulus. I went into the room and to my surprise, indeed, the patient looked very well. He was not fussy. I also did not believe that his abdomen was tender. He was not crying when I was palpating the abdomen. And I had a hard time believing that this child actually has malrotation with volvulus. Then again, we all know that the differential diagnosis for true bilious emesis in this age is pretty narrow. After several hours in the ER and full workup, indeed, the upper GI was positive. I spoke to the surgeon who took the child to the OR the next day after placing an NG tube and giving fluids, of course. And the next day, the surgeon informed me that indeed the child had malrotation, but he had intermittent volvulus. In other words, when we saw the child, he was not volvulized, which is why he looked good, sounded good, had normal vital signs, etc. However, it almost always goes back to the history. The child had bilious emesis, which was not normal, and because he had intermittent volvulus, he looked fine when we saw him. So remember rule number 159. Be aware of the intermittent conditions. What you're seeing in front of you may not be the whole picture. Rule number 160. If you're a trainee, enjoy it while it lasts. Though being a trainee and being a learner hurts a little bit, learning hurts a little bit, and training is certainly difficult, challenging, residency and fellowship were not easy times, there's not a lot of sleep, there's a lot to do, and it's oftentimes a difficult transition from being a medical student, and I totally understand all of those things. However, I always tell my trainees, if you are a trainee, enjoy it while it lasts. As a trainee, you get to take care of patients and practice medicine while being a learner. And that means that hopefully someone is always teaching you, You practice in an environment where you always have help, and essentially you don't carry the full responsibility over the patients. You should always have an attending or someone to go to. As a trainee, you also have a residency or fellowship director, somebody who can always help you, or at least should help you, with any problems or challenges that come to mind. So being a trainee allows you to practice medicine, learn medicine, see patients, enjoy the aspects of medicine while not carrying the full responsibility, and have the privilege of learning all the time. So if you're a trainee, enjoy it while it lasts. Rule number 161. Start with the basics. As with any aspect of medicine or any field of medicine, there are certain presentations or conditions that we PEM clinicians see all the time, and it's extremely important to be experts in those conditions. So if you're PEM clinicians, you must know everything about UTI, viral respiratory infections, pneumonia, asthma exacerbations, etc. And although many of those conditions or presentations seem very boring, not particularly engaging, it is extremely important as a PEM clinician to be very familiar with them and pretty much know everything about them. We as PEM clinicians need to know everything there is to know about asthma, because we see a lot of kids with asthma. And as boring as URI may be, we PEM physicians and PEM clinicians need to know everything about URI, which really translates to what not to do. No over-the-counter medications, etc. So always start with the basics. If you are a PEM clinician, know everything about those conditions we see all the time: acute otitis media, UTI, asthma exacerbation, viral illnesses, gastroenteritis, etc. Start with the basics. And that is it for today, guys. Thank you very much for listening to PEM Rules. Short episode today. Let's review what we learned. Rule number 159. Be aware of the intermittent conditions. Sometimes what you're seeing in front of you is not the full picture. The patient has intermittent valvulus and looks okay right now. The patient has interception and right now looks okay while you're interviewing the mom or the dad and examining the child. There are certain conditions in medicine that give you intermittent symptoms, and one must realize that what the patient is looking right now may not be the full picture. Rule number 160. If you're a trainee, enjoy it while it lasts. As a trainee, you get to practice medicine and learn medicine while always have help around you and always be engaged in teaching and learning. Rule number 161. Start with the basics. As a PEM clinician, know everything there is to know about those conditions we see all the time, namely viral illnesses, asthma exacerbations, etc. As simple as they may be, there's always something new to learn. And that is it for today, guys. Thank you very much for listening to PEM Rules, and thank you for supporting my podcast and my website. The following outro is dedicated to the funniest person I know. She just opens her mouth and I crack up. I hope you like this outro. Have a great day.